Hey, how you doing today? What can I do for you?
Hey, my name's Michael. I'm a level 1 nursing student. I was hoping I could shadow you today maybe for a minute and go while you're working with your patient.
Okay, sure, no problem. So I've got a patient here that we're getting ready to give some insulin to. I'm going to go over that with him. The gentleman's name is Greg Lutz. He's 67 years old. The patient is going to be receiving insulin for his hyperglycemia. So he's room 621. He's a 67-year-old male with no allergies. He's admitted for non-healing diabetic foot ulcer and hyperglycemia. So he is medium fall risk. He does have a pressure sore. He is at risk for pressure sores. So that admitting diagnosis was stage 2 diabetes ulcer on right heel and diabetes mellitus type 1. So he complains of increased glucose for the last 5 days. It's been in the 300. Patient notes that the non-healing wound on his right heel has been there for about 3 weeks. So his history, he is a 20-year diabetic. He's insulin dependent until about 3 years ago. The glucose, or about 3 years ago, his glucose has always been in the range from about 120. Patient reports that he is doing a 1800 American diabetes diet. He doesn't exercise, denies any cardio, respiratory, gastrointestinal problems, no voiding problems or musculoskeletal problems, denies any headaches. However, he is noting that there's tingling in his bilateral lower extremities. It's been worsening over the last 3 months, but denies any other weight gains or any kind of genitalia or lymph problems. So his vital signs is his weight is 171, his height 5'11", respiratory rate 16, pulse rate 76, blood pressure 128/70, and oxygen stats 96% on room air. So he does have an IV in the right medium form. It's a 20 gauge needle. And so his blood glucose was 242. So we're going to go ahead and administer insulin for him. We're going to do a premix. It's going to be an insulin isophane NPH and a regular recombinant Humulin 50/50. So we're going to have 2 insulins, the NPH, which is going to be the immediate acting, and the regular insulin, which is going to be short acting, okay?
All right. I have a question though.
Sure.
Why specifically is the client receiving this medication?
Well, he's receiving it for his hyperglycemia.
What action does the medication have on the body?
The insulin promotes the storage and inhibits the breakdown of glucose, fat, and amino acids, so it's going to facilitate the uptake of glucose.
I'm sorry, I have another question for you. I'm sorry,
Sure,
I'm
no,
level
no
1. When should you question administering this medication?
You're going to question administer when the patient's glucose is in normal range, so anywhere between 70 and 99.
Is there a serum level we can check or something on that drug? Is there a therapeutic level?
No therapeutic serum level for the insulin. You're just going to monitor the glucose.
Okay, there's some vital signs we got to keep an eye on.
Yeah, we're gonna monitor his pulse, his respiratory rate, checking for hypoglycemia.
I'm sorry, one more.
Okay.
Which physiological parameters should be monitored when the medication is being administered?
Well, we're gonna check his alertness and orientation. So you're gonna make sure he's not dizzy, sweating, agitated, shaking. So we'll look for those type of things.
You know, I got to know what interventions must be taught to the client.
So we're going to need to teach the patient about his blood glucose levels, what's a normal level and what's not a normal level. We're going to make sure that we're teaching about alternating injection sites. Make sure that we're going to check ourselves his 5 rights. So we're going to check for his right dose, the right patient, the right medication, the right time, and the right route.
Okay.
So, and then for him at home, what we're going to teach, and I think that's what part of the question you're asking, right? So for him at home, we're going to teach what his normal blood sugar level, so he'll know when he's supposed to administer it, and also just moving in the injection site so he doesn't cause himself any kind of fat buildups.
Well, I guess I got to ask you about side effects and adverse reactions too.
So side effects for him, what we're going to be, or in general, side effects for this, we're looking out for hypoglycemia, we're looking out for headaches, and also rashes.
And this really is my last question. I'm sorry to bother you. How will you know the medication's effective?
Well, once we administer the medication, we'll recheck his blood glucose level, and as long as the level's coming down to a therapeutic level, then we'll know that it's been effective.
All right, I guess that's all I got,
We're
man.
going to meet the patient?
Yeah.
All right, no problem. Maybe not.
Sorry, I'm so disturbed right now.
Hey, you guys doing today, too?
I'm doing good. Don't worry.
All right. So Greg, my name's Chase. I'm gonna be your RN.
Oh, hi, Chase.
How you doing? So I have a level 1 student. Be okay if he comes in to watch with us? Okay. Well, come on in, Mike. Let me close this. Give you a little bit of privacy. All right. If you can do me a favor real quick, can you tell me your name, and date of birth or age?
Greg Lutz.
Mm-hmm.
I'm 67 years old.
Excellent. So we're in here today, Greg, because we're going to give you some insulin. All right. Your glucose level, let me just check here, was 242. So we're going to need to get that level to come down. So we're going to give you some insulin. We're going to give you some intermediate insulin, which is the MPH, and we're going to give you your regular insulin. That's going to be a little faster acting, okay?
Okay.
You have any questions about that or any concerns?
Nope.
No? Okay.
Sounds
So,
like it is.
are you having any pain right now from a scale of 0 to 10? 0 being no pain?
I'm fine.
You're fine? Okay.
0.
So, what's that level? 0? Okay, excellent. So, I know that you were asking a little bit about information in reference to the insulin. So, a diabetic diet, basically, you're going to want to make sure we're following, foods with low to no sugars, low carbohydrates and stuff. So, got a little bit of information for you on that and just information about the insulins, the 2 insulins we're given. So,
Okay.
now you've been on insulin for quite a long time. So, any no questions or concerns about it today?
No, I'm pretty familiar with it.
Okay. All right. So let me go ahead and get everything started. Just let me get my charting going, and I'm gonna check these medications real quick, and then we'll just administer it. So let me take a look. First one here is.
I was gonna start shooting at you because I wasn't sure if you did it.
Just gonna do my quick checks here.
With the stage 2 diabetic ulcer on his right heel that he's had for about 3 weeks. He's also type 1 diabetic. He's been diabetic for about 20 years now. He's a medium fall risk, at risk for.
Do me a favor, just one more time. Name and
Vitals are 90%.
age.
Greg Lutz, 67 years old.
6%.
When you click onto the medication, they're gonna ask you
Blood pressure around 28 over 70, and
And any allergies? Any medications for you?
checking those
No.
every 8 hours.
All right.
That I'm aware of.
The last look
and
was 290,
check the right
and so we're
route
gonna give
goes
him
into, then you're gonna click on that like you're gonna give it, and that would prompt you to scan it again. Yeah.
He
and
also
you
came
didn't
in
do
with,
it the next
he's
step.
been having really high blood sugar, in 300s recently.
Okay, sort it.
Um,
We're gonna do now.
the
You got
wound
like
on his
5
right
minutes.
heel is 5.5 centimeters by 2.5 centimeters. It's 3 centimeters in depth. The wound base is pink, no tunneling. He's got some moderate serosanguinous exudate. He's also complaining of some tingling in his lower extremities. He's got an IV in his right forearm.
Okay. So where do you normally administer your insulin?
Right in my belly.
Are you about
most of
right
the
side,
time.
left side?
I kind of move it around. I'll go right, left, top,
Okay,
bottom.
good. So you know it's important to move it around. The last site that you had it, where did you say? Was it the right side you said?
Yeah.
Okay,
Yeah, over
so
here.
we're gonna just rotate. So do you want me to rotate it to the left side today?
That'll work.
Your left side. Okay, excellent,
Everything
no
else
problem.
is good. His assessment is awake, alert, oriented. He's got a steady gait.
So you're gonna click on the
Clear,
green?
unlabored.
To scan.
Heart sounds are normal.
Right.
Normal rate, rhythm. Bowel sounds in all 4 quadrants. Abdomen is flat, symmetrical, no tenderness, no voiding problems. He's got a 5 out of 5 shrink. And so what we're gonna do is turn him every 2 hours to get pressure off that heel to prevent future ulcers. We're gonna monitor his blood glucose and vitals.
Alright.
We are going to administer.
One more
insulin
time, I'm just gonna
according to
scan the
doctor's
ID
order.
band since this is 2 medications.
The diabetic diet, and then we're also gonna clean and irrigate the
Hello,
wound with
my name's
normal saline
Kristen, I'm a
and
nursing
cover with
student,
dry.
level 1. Would you mind giving me an
Thank
SBAR
you.
on your patient?
Why specifically is this client receiving this medication? What action does the medication have on the body?
He's a type 1 diabetic, and he's got high blood sugar, so you wanna get that down. And the insulin helps move the glucose into the body cells for energy needs and to prevent hyperglycemia.
All right, almost ready here.
When should you question administering this medication?
If he's had excessive activity or exercise,
Right.
the blood glucose is under 70, he has any allergies or hypersensitivities to it, any changes in weight.
So how are you feeling today, Mr. Greg?
Fine.
Does this medication have a therapeutic
better
serum?
now.
It does not, but we're gonna document when the blood glucose goes down. So you
Is
want
it doing much better now?
Yeah.
Which vital signs must be monitored?
obviously the blood glucose, heart rate.
All right, so I'm just getting my insulin out here. So we're gonna put a little bit of
What
air in these bottles
physiological
first.
parameters should be monitored when the medication is being administered?
So we're gonna look for hypoglycemia, so any symptoms of
Put a little bit of
anxiety,
air in
palpitation,
my.
shakiness, hunger.
So we're gonna give you 20 units
What
or,
interventions
of
must
the
be taught to
NPH
the
and
client to
16
ensure the
units of the
medication is
regular.
administered safely in the hospital setting?
Okay.
We're gonna make sure we're monitoring blood
No
glucose.
questions, right?
Sounds like a plan.
Exercising, notify us about the last injection site so we can rotate sites, to prevent any fat buildups in that area. Make sure he's eating his meals fully.
What are the side effects and potential adverse reactions?
So hypoglycemia, obviously, anaphylaxis, any irritation or
Okay,
redness in that injection site.
Why specifically is this?
What
client
interventions
receiving
must
this
be taught for
medication?
taking the
What's
medication
action
safely at
the
home?
medication has on the body?
At home, we wanna make sure that he's storing it properly, make sure the insulin's not expired, he's not sharing needles, only using one needle, and
Alright,
disposing it in a
excellent. So
sharp
16 units
container,
here. We're gonna get
monitoring
20 more
his
units
blood
here.
glucose level.
How will you know the medication is effective?
When his blood glucose level is going down.
Okay, thank you.
When would you question administering the medication?
So, see
Okay,
how he's doing.
and does it have a therapeutic serum level?
Alright.
I'm just sure, how are you doing today?
Excellent. So get your roll up your shirt here. We're gonna clean your ejection site.
This is Robert's nursing one student, he's gonna be following me today.
Circular
Should be
motion.
monitored when the medication's being
So
used.
today, we're gonna be.
All right, 2 inches from the umbilicus.
According to the sliding scale
Inch.
from the doctor.
Okay,
Your blood
and what
glucose is at
interventions must be
290
taught to
right
the
now.
client to ensure medication
Have you
administration
received
safely
this
in the
medication
hospital
before?
setting?
Alright, excellent.
Okay, and have you had any reactions to it?
Alright, doing okay?
Allergies?
I'm good with this.
Alright.
What are the side effects?
Alright, excellent. So we've got everything in here. So we are gonna come back in to recheck your glucose in just a little bit, see how that insulin is working. Okay? Alrighty, so we are all set. So Greg, you have a great rest of your day. We'll see you back in just a little bit, okay? I'm gonna sneak on out.
Thank you, Chase.
Signs of hypoglycemia, just shakiness, palpitation, headache, fatigue.
Alright, excellent. So you saw us give some insulin there. You have any other questions?
Yeah, I mean, some things that came across my mind. Was there any pertinent pieces of information that you reviewed before administering the client the medication?
Sure. So, as you saw in there, we went ahead and reviewed where he gives his administration site. We also reviewed his 5 rides. So we did our 3 checks, and we made sure it's the right person, right route, and everything that we discussed. And then we checked the medicine, like I said, 3 times against the MAR, and we also checked his glucose level. So it's important because we want to know on that sliding scale how much regular insulin he's going to need. It's also important that we change sites to make sure that doesn't cause any issues. So that's why.
Did the information, did it affect your decision to administer the medication?
It did. It did. It helped me determine that we would actually give the medicine based on what his needs are, and also where we were going to give the medication.
Received your insulin, so I can rotate it.
And I guess my last question, did it affect how you administered it?
It did, and pretty much once again, how we administer is the amount we administered and where we administered it.
Yeah, I appreciate your time. I know it's a pain sometimes having a student shadowing you, but I appreciate you answering my questions.
Not a problem. Have a great day.
Thanks.